Okay, so this is going to be for your practical exam. We're going to do this in sections. This is strictly the impression procedure, okay? So if you look at this table, this is what you should have for the impression. You should have your material, your impression tip, otoscope, specula, ear light, your various foam blocks, hand sanitizer, and alcohol wipes, okay? The very first thing that you ever always want to do before you do anything else is sanitize your hands, okay? So always take your hand sanitizer, make sure you get all the insides and in between your fingers and all around on the top, okay? Next thing you want to do is you sanitize whatever is going to touch the patient using an alcohol wipe, okay? So you open up one of your alcohol wipes. The things you want to sanitize are your ear light, just the tip, your specula, and the impression tip, okay? Just like that. The next directions, they will tell you to look in your patient's ear and say everything you see out loud, okay? So you want to take your specula, put on your otoscope. Now, when you're looking in the patient's ear, the most important part you always need to remember is bridge and brace. What I mean by bridge and brace is that you need to have either one finger or your palm of your hand, however you want to do it, you need to have something always bracing against the patient's head. If this finger or this point of contact ever comes off your patient's head while you're doing something in their ear, the instructors will immediately stop you and you will fail. Okay, so you always want to make sure this stays on the head no matter what. So, to look in the patient's ear, bridge and brace, pull the ear back a little bit, and look inside the ear. You want to say everything you see. You can say, I see the first bend, I can see the second bend, eardrum looks clear, I can see the cone of light, there's a little bit of wax on the posterior wall, but other than that, there's some strands of hair, but overall, it looks pretty good. After that, you can disconnect the bracing, and then the instructors will look in the ear and confirm what you saw. After they confirm it and they say you can continue, then that's when you need to start doing your impression, okay? So first things first, you always want to make sure you choose the appropriate size of the foam block. I would highly recommend you practice this at home with the person you are bringing so you know exactly what size foam block you're going to use. So in this case, I'm going to use the white one, okay? Always, 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 this is never touched by you, okay? So it's always hanging around like this, okay? Before you put this in the ear, you always want to tie a knot. So all I simply do is just kind of tie it, make just a simple knot, pull it over like that, and that's it, okay? After that knot, just take it, take your ear light, again, bridge and brace when you do this, okay? So, I'm gonna brace with my pinky. I'm just gonna have this hang like this over his ear, okay? Once it kind of gets near the ear like that, I'll take my ear light and I'll just kind of put it into the ear just like that. Once it's kind of settled, you can let go of the string, it'll stay put. You can pull the ear back to straighten the canal and start putting in the foam block, okay? Just like that. And you gotta make sure you just do it nice and slow. Make sure you tell the person that you're bringing that they do not flinch at all, okay? You do your best not to hurt them, okay? But you always try your best to go slowly and without any pain. You can always ask your patient if they're doing okay, if they feel any pain, just like that, okay? You doing all right?
All right, just a little bit of pain.
Okay. Once you get to the appropriate length, you can let go, bridge and brace, all that same thing. Before you do it, you always want to take your otoscope and make sure there aren't any gaps, okay? So again, bridge and brace, pull the ear back, make sure it's a good distance, there are no gaps in the ears or in between the foam block, and the canal, and you're all set, okay? Once you can do that, the instructors will look in the ear, confirm that there aren't any breakages in between the foam block and the ear canal, and they'll either, if you have a gap, they will not tell you, okay? If you have a gap, they will not tell you. If you continue the impression and you, right before you pull the trigger, if you still don't realize you have a gap, they will stop you and you will fail, okay? So you always want to make sure you don't have any gaps anywhere, okay? Now, in this case, once they're done, you want to get your impression material ready. So, uncap it, put this on, and then, okay. So, you always, of course, you always want to have a tissue just in case. Take that tissue. One thing you always want to do is you want to bleed out the material, okay? So bleed it out just a little bit, just like that, okay? Making sure that it's nice and mixed in, okay? After that, again, you want to bridge and brace. The way you bridge and brace with the impression is your thumb and your index are always on the tip no matter what. And this hand, your left hand, is always flat against the patient's head like this. So if you look at my material, it goes in like this. Kind of just scooch it in just a little bit. Okay, once you get a good depth, you pull the trigger. Okay? And then you slowly keep it together, but it slides through your finger and your thumb. Okay? You need to do a complete impression, so you want to go over the helix. Okay? Get the entire concha, and you want to cover both the antitragus and the tragus. Just like that. Okay? I have it all set. Again, your finger should never leave the patient's head, and your thumb and index finger should never let go of the tip during this entire time. If it does, they will stop you and they will fail you. Okay? When you get to the end, just kind of make it into a circle so it doesn't drip or droop, and that's it. Okay? During this time, while it's drying, the instructors will give you hearing aids to troubleshoot, and they will tell you to fit a mold, a brand new mold, onto a dummy ear. Those will be separate videos, but strictly just to let you know that's what's going to happen while this impression is drying, okay? So after that, kind of just let it sit, and then when it's dry, we'll take it out.